over here into our benign breast disease. So benign breast disease, we can really divide this into four main breast diagnoses. So we're gonna first start with the breast cyst. So this is gonna be a solitary, well circumscribed mobile mass, and this means tenderness. Fibrocystic changes, guys, is going to be over here the second type, which is going to be with any sort of menses. So this is going to be diffuse nodulocystic masses, cyclic, premenstrual tenderness. Then the third one is going to be fibroadenoma. Fibroadenoma, guys, remember, it's a very estrogen sensitive. So it means solitary, well circumscribed mobile mass, and this is going to be cyclic, premenstrual tenderness. The last one is going to be fat necrosis. This is usually after a trauma or any sort of malignancy. So it's firm, regular, echymacosis, skin nipple retraction. So really, it's really like kind of mimicking a breast cancer, and but it isn't breast cancer. So breast cysts are soft, fibroadenoma are hard. So that's a key differentiating factor. Okay, fibroadenoma, we have spoken about this. Let's just speak some more points. So this is going to be single, unilateral, well circumscribed mass, increased pain and size prior to menses. We can do observation, reassurance, ultrasound of persistent mass, an older person. We got a person over here. I had a question over here, 27-year-old female. She had a breast mass which shows 2 centimeters, well defined, mobile, non-tender mass. What's the next best step? So it's going to be observe, reassure, maybe do ultrasound, but re-observe. The correct is going to be do ultrasound of the right breast, and the wrong answer here was to follow up. So we do want to do, if there is going to be a mass, we want to do some ultrasound, just to be sure. Intraductal papilloma is benign papillary tumor that arises from the duct lining. Unilateral bloody nipple discharge, can be non-bloody, non-associated breast mass or lymphadenopathy, mammography, ultrasound, biopsy, and excision. So we have over here a question for you guys. What is the diagnosis in a young woman with bilateral non-focal breast tenderness, diffuse cord-like thickening of the breast with no discharge? Her last menstrual period was 3 weeks ago. It's going to be fibrocystic change. So we can see it's diffuse nodular focal tenderness, fluctuates in menstruation. Treatment is going to be supported bra, NSAIDs, fibroadenoma, NSAIDs re-examined post-menses, and should show decrease in the size of the cyst, maybe cyst aspirates if persistent. So the size and tenderness of fibroadenoma, so less than 30 years, and breast cysts is going to be above 30 years, increase with exposure to estrogen and pregnancy prior to menses. So fat necrosis, as I spoke previously, this is going to be calcifications or mammography. Fixed mass of physical exam mimics breast cancer. So we can see a fixed mass with skin nipple retractions give the appearance of calcification, mammography, hyperechoic ultrasound. So what's the next best step? Reassure. We don't need to go any more lymph node dissection. So reassure and observe them. We have a CMS question where 23-year-old female with serous angiosis unilateral from the left nipple, 2 millimeter nodule underneath the left areola. What's the diagnosis? Ductal papilloma. We have another one over here again. CMS question, 23-year-old female with unilateral bloody discharge from the nipple and from the nipple, left nipple underneath the left areola. What's the diagnosis? Again, ductal papilloma. Breast cancer is the wrong answer here. This is more an elderly female. It wouldn't be seen over here. Okay, let's wrap it up here.